So good evening, everyone who's here. Thank you for joining us. My name is Melissa Alvarez. You might see my name hyphenated on the screen there. I go by Dr. Alvarez and Mrs. Downing. So my professional career, I'm Alvarez. I am an assistant professor of surgery at Rutgers, New Jersey Medical School. I'm also the clerkship director for the third year medical school surgery clerkship, as well as I am a colorectal surgeon here in Rutgers. So in terms of my background, I always like to share I am Latina and Puerto Rican. So I will be starting a little bit today on our discussion on, pursuing a career in surgery and some tips on how to be successful, along with my colleague here, Dr. Villena, and I'll let him introduce himself now.
Thank you. So my name is Jonathan Villena. I am an assistant professor here at Cornell in the Upper East Side. It's a very nice hospital. I come from California, but originally from Peru. Like I said, I'm a thoracic surgeon, technically a cardiothoracic surgeon, but I do mostly thoracic surgery, and I'm focusing on lung cancer, and I do a lot of research in that. I also interview for the medical school for Cornell, as well as the MD PhD program, which is the Tri-Institute, including Rockefeller and Sloan Kettering. So I had to interview a lot of people in addition to the CT surgery fellowship. When somebody wants to apply to CT surgery fellowship, Cornell is a very highly regarded program, and we interview a lot of really top candidates. So I think, between Melissa and I, we'll have a good understanding of what we're looking for at our level, and how that's kind of changed throughout the years, and how important, all these different factors that we look for in surgery candidates are important. And the most important is, to see specifically why you want to be a surgeon, and what it entails as well, including a research scientist or a research surgeon. So go ahead, Melissa.
Absolutely. So so I'll get started. So I need to be able to share my screen. Just realizing it didn't let me. Just see if I can. Okay, great. Okay. Thank you. This is one. Okay. Jonathan, I'm just going to confirm you can see, right? You can see it. Okay, good. All right. So again, I introduced myself, and I will add sort of what Jonathan mentioned is that I also do a lot of advising in my role as clerkship director, and just being involved in the medical school. So a lot of advising for people who are applying into surgery. So just to kind of go through sort of some of I always like to give this slide, the introduction of sort of like whatever the roles are, because you all will hear, I'm not so sure, depending on the your level of training in medical school, you'll hear a lot of these words passed around. So obviously there's medical students, which I believe all of you guys on this call are. When you go into your first year of residency, regardless of what it is, whatever specialty you choose, surgery or not, your first year is designated as your intern, just a terminology we use in the medical field to sort of understand it's the first year out from medical school. And then after that, it's you become a resident, and sometimes you'll hear us say junior resident or senior resident, but that's just kind of, again, while you're going through your training. Once you've finished your training on whatever specialty it is that you choose, and you decide to specialize, so like I specialized in colorectal surgery, and Dr. Villena specialized in cardiothoracic surgery, then you go and do a fellowship training after your residency program. And then once you've graduated from that, you are an attending. So myself and Dr. Villena are both attending surgeons at our institution. So just to sort of advise that. I always kind of give a quick spiel to you guys on things to be thinking about and how to be successful in medical school, because this will certainly apply to when you're thinking about applying to surgery in particular, which has become quite competitive over the past several decade or so. So I think first things that I always say is to make sure that you identify advisors, mentors, or anyone who will support you early on. So if there's anyone on the call who's like a first or second year, you should definitely have your advisors and mentors, people that you've either identified who teach your class or that are just involved as either mentors within the medical school or advisors. Sometimes programs will have, like for us, we have faculty advisors for small group sessions, things like that, where you're sort of interacting with people. I do have a lot of students reach out to me during those times when I do those sessions, who are interested in surgery, or sometimes just who are Latino students who are looking for someone who's a Latina to sort of guide them through, navigate through the medical school and career path that they choose. I think that also choosing your study group is really wise. So if you're within those first 2 years and you're sort of still kind of figuring this out, super, super important to make sure that you study with people who are similar to you and who will enhance your success. Someone who, is a really good test taker and barely shows up to class or barely reads. And if that's not how your style is, then wouldn't be the best person to be sort of becoming part of a study group with. And I always say this, that you should just really got to develop a habit of studying every single day. Very, very important, and will translate sort of into your future career regardless. Support your learning environment, balancing work with play and involvement in student organizations is all super important during medical school. And in terms of, I think, being able to branch out, some of it's for your sanity. And it is always nice in your application. We see students who are sort of well-rounded, who have been involved in different things in medical school, outside of just, studying and doing the academic stuff. One thing that I always share with you all is that for me, I think my biggest mistake was what you don't know, you don't know. And so I think the way that for you in terms of thinking about success, that part of the reason why we're having a seminar like this is to give you guys advice on, so that way you sort of know what you don't know. But one of the other ways to do that is that's where the mentors and the advisors really come into play, because they'll start raising things up and issues up that you just weren't even aware of that you should be thinking about as you're considering your future career. So super important. Obviously once you kind of get through your third year, or perhaps I feel like you guys nowadays, this generation decides a lot sooner, you'll be thinking about what type of doctor you want to be, once you're finished. And there's really a lot of, different considerations to take, some exposure and practical considerations. So obviously you'll do your clerkship rotations. So that will give you nice exposure to each field in medicine. You'll have your faculty advisors, and sometimes those people will sort of influence your decision. Some people think about lifestyle considerations, and certainly I think that's very important to think about what sort of life you want to have once you're out, like us, like myself and Dr. Villena. The length of training is important to some people, perhaps like, for family or personal commitments, sort of the amount of time you're going to be training. As well as, the time commitment for that. So all things to be considering. And so I always put up this, again, this slide that shows that there's obviously a very big difference in terms of the residency programs and what you decide to pursue. So surgery is certainly one of the longest residency programs of 5 years compared to something like in pediatrics or internal medicine. So just something to keep in mind in terms of time commitment and what that means. I do always say, though, that if you are going to specialize after you do something like internal medicine, you may end up doing a 3-year fellowship anyway, which sort of still ends up into a surgery, similar to surgery in terms of a 5-year residency and a 1-year or 2-year fellowship is usually 6 or 7 years for surgery. And a lot of the other specialties can sometimes end up in that same amount of training also. So just be mindful of that. So again, really starting to think like down the line. When you're applying to residency, these are sort of the important things that we look at. And I do a lot of interviewing for our residency program here at Rutgers. So I do interview for the medical school, and then I kind of have that perspective of students who are fit for medical school, and then also for students who are, a good fit for our program in terms of becoming surgeons. So these things are all really important and things that you really have to start thinking about early on. In terms of how you present yourself, recommendations, and who is going to be writing those. Your grades are very important. Test scores going along with that, as well as research, which Dr. Villena is going to talk a lot about, and then your personal statement, and which is really just a way for you to tell your story about how you decided to kind of navigate or come to a career in surgery. So these are all super important aspects of your application. You think about applying to residency in surgery. Again, fellowship training is that specialized training you take after After residency. So if you want to be a colorectal surgeon, for me, I took, I did my general surgery residency training, and then colorectal surgery is a 1-year fellowship. So it is specialized training afterwards. Some people do fellowships that are just in research. I had done a research fellowship myself at the National Cancer Institute before my colorectal surgery fellowship. And some people take time off and do fellowships like in order to get or fellowship year in order to get like a master's in public health or business administration or something like that. So again, I think it's really, really nice to be able to start to think ahead about like what are some of the goals you have and things you want to accomplish. In terms of becoming an attending physician, both myself and Dr. Villena are at academic centers, but there are lots of different types of positions that you can have, whether they be what we call academic affiliated, which would be like one of our smaller hospitals affiliated with Rutgers, private practice, or community-based hospital, rural hospitals, or doing things like mission trips. So really, really varies in terms of what sort of a position you want to be in. Again, I think Dr. Villena will speak a little bit about that academic piece in terms of the research component and how that really does play a big part into being an academic surgeon and a surgeon scientist. So in case you've just been wondering, I always get this like, wait, how many years are we talking about? It could be quite a bit in terms of finishing medical school, going through residency, and doing your fellowship. Again, surgeons are 5 years residency and 1 to 2 years. So for me, I did 2 fellowships. So it can vary in terms of your numbers of years of training, 11, 12 years sometimes. So depending on what it is that you choose to go into. Fellowship length is variable in terms of like colorectal surgery is 1 year. I think cardiothoracic, right, Dr. Villena is usually 2 years. So it varies depending on the specialty that you choose also in surgery. So I get this question a lot, like, what is it like to be a surgeon? This is I love this cartoon. It's a picture of a surgeon's operating, and it says, "My nose does not itch. My nose does not itch." Because yes, once we are sterile, we cannot touch our faces or anything like that. People ask me, "What do you do when you have a long surgery? You can't use the bathroom." One of the things I always tell people is I think that once you become a surgeon and you're sort of like when you are operating and doing engaged in surgery, all of those sorts of things drop to your mind. And I can't even remember the last time where my nose itched. I may unscrub them and realize, oh, my nose really itches. But in that moment, it's not really something that crosses our minds, I think, because we're so focused on what we're doing. In terms of the practical aspects of what it's like to be a surgeon, we do have a clinical schedule and then for me specifically, I have administrative duties because I am the clerkship director. And frankly, as well, I run the DEI committee here in the Department of Surgery and a lot of other hats that I wear. And then there's a lot of professional satisfaction with the teaching, the education, the research, the community involvement that happens. So for me, when I do office hours, my standard day can be very straightforward. I do small procedures because I'm a colorectal surgeon. So sometimes I do colonoscopies or like a hemorrhoidectomy, and those can be 30 minutes. Sometimes I do a really, really advanced robotic case that takes 6, 7, 8 hours. People always want to know, like as a surgeon, how often I'm on call. You've heard that term before. It's when we have to take care of any emergencies in the hospital or emergencies that pertain to our specialty. Super variable for me and really varies depending on where you work. And then people always ask, like if I have to work in the middle of the night. That has happened before. I'm currently on call right now just for acute care surgery, which is not my specialty. But if I got called in for an emergency, yes. However, it doesn't happen very often. And particularly in my specialty, this happens almost never. Again, it's sort of part of your training, you learn how to manage that. I just sort of list all of these things to let you know, these are just a small amount of what I do and part of what it's like for me to be a surgeon. So a lot of different hats to wear, a lot of different roles. And again, I'm in an academic institution, so this would vary a lot potentially for someone who's, let's say, a community-based hospital. It takes away a lot of the administrative stuff, or just perhaps a clinical surgeon where you are just operating and seeing patients in the office. Teaching is a big part of of my career. Again, academic hospitals, you tend to do a lot of teaching with medical students and residents and trainings. And like Dr. Villena mentioned, he has fellows and stuff. So teaching is a big part, but some people work in hospitals where they're not trainees there, and they're working with other types of support staff. So I'll end with my little piece about being a female surgeon, because I get this a lot. I know people always want to know, like, how, with all of those things that I just showed you, how is it possible for me to do anything else? Yes, there is time to do everything else. One of the things that I like to say is that it's not really work-life balance. It's more of work-life integration. And there are times where I'm certainly, my career is at the forefront. I'm doing a bit more sacrifice and time to my career. And then there are other times where prioritizing my role as a mother, as a wife are more important. And I'm, running out early so I can, make my anniversary dinner, or I'm coming in a little bit later so I can drop my kids off at school and do that, parent teacher conference, things like that. So it can vary from day to day or from season to season, just depending on how life is. So just want to put a plug out there that these are all the roles that I have, and very, very possible to be all those things and be them well. I am a mom, as I mentioned. I do have 3 munchkins. This is a picture we took when I was my 3rd one, and I wasn't even as big as I got at the end there. No one could believe that I was like having a baby and a surgeon and operating like that. My patients were always a little appalled when they saw me. But it's totally possible. And I think my mantra is always this, is that you can have it all, just not all at once. So again, takes me back to the comment I made about work-life integration, and really at times being a bit more delved in. My personal life is a bit more front forward if I have a sick child or something going on, versus other times when my, I have a deadline of paper due. I have a really sick patient, I have call, whatever, those sorts of work commitments are, I'll take the forefront. So I'm happy to answer any questions about that, because I know that sometimes comes up in terms of what it's like to be the woman, person, surgeon. So this is sometimes me, FaceTiming my kids just so I can see them on my way to the OR. So I think it's just a great, fact that it is possible. But again, there's sometimes a little bit of compromise and juggling back and forth, but totally possible and doable. So I will end with that, and then hand it over to you, Dr. Villena.
That was great. It takes me back a little bit to, hear all the steps that we have to go through. And, I always try to think of myself as a medical student again, and trying to figure out how I, basically decided upon this specialty. But, I'll show a little bit. I don't know if I'm sharing my screen yet or not. Probably not, but I will. So just to give a little bit of a background. So for me, I did medical school, then I decided to do surgery after my first year of medical school. I didn't know I was going to be a surgeon at first. I did a clerkship, and then I really liked it. At the time when I was going through medical school, I guess, and it still may be the same thing, which is you decide either surgery or not surgery. That's like the big major decision in medical school. And so I did a surgery clerkship between my first and second year, and decided that I really enjoyed it. And that's why I kind of went the surgery way. Then I did general surgery. And then in the middle of general surgery, which is a 5-year program, I wanted to do research. I've always liked research. And I always thought that the residents that came back from doing research always seemed a little bit more mature. So I was lucky enough to get a spot in it and do research. And I actually did. So between my second and third year of residency, I did 3 years of research. You technically should only, some programs require 2, some programs say, okay, whatever you can. Some programs don't require it at all. Originally I was going to do 2 years of translational research and bench research because I liked it. And then I added a 3rd year because I wanted to really show that I was committed to that sort of career. Not required, but it was nice. Then I went back to residency and finished my residency, which was nice too, because I'm really happy I was very nice to my interns, because they were all my chiefs when I came back. And so that really saved me. And then I finished that, and I decided to go into the fellowship in cardiothoracic surgery, which added on another 2 years. So as far as that, 7 to 11 or 5 to 11, I'm definitely on the 11 side of that. But if you choose wisely and you get to do exactly what you want to do, and there's no career really that matches what we do, and that's why I guess everybody's here. But I think it's important to see that the first thing you got to do is really decide that you want to we want to do it, and then also actually get in, right? So it's highly competitive, as Dr. Alvarez was mentioning. And for me, I always like to see data, and data to me kind of helps me delineate what's important from everybody else's point of view. So you'll see here, this is from JTCVS. So this is for these highly competitive kind of CT surgery. What are they called? Those joint residency programs. So you don't have to do a fellowship. So these are more competitive than just going to general surgery and then specializing. But this is really what people are looking at from the program director's point of view, at least in this paper. And you'll see how things kind of pan out as far as they surveyed a bunch of program directors, and they said what is really important. And if I look at this, and by the way, feel free to ask questions, especially in the chat. We'll try to answer them as they come. But as you can see, communication skills is 94%. So that's incredibly important, and to me, that means, that's usually the interview process, or what you write down, obviously in your applications, but in the interview process, that you can really clearly say why you want to be a surgeon, and how you got to that path, and what you want to do with it. And speaking that clearly is incredibly important. It really kind of gives us a gauge of who you are, and how everything else kind of, how you basically are able to communicate not only what you want, but also how you're going to be as a resident, because a lot of it is communication about the patient, about how the patient is doing. And we just know that it's a good way of moving forward, and that you'll be successful if you're a good communicator. You'll see that the second thing's in line, and these are things I want to be really clear about with you guys, so you guys can make a checklist. And when you apply, you really want a checklist of all these things, and say, okay, how can I show this, or how can I do this? So clinical rotation in the same hospital. Obviously, everybody knows if you do a sub-I, you're more likely to get at least ranked in that place. So I think that being strategic about that is very important. Leadership, it seems very vague, but when you do your application, you want to have that check mark. So whatever way you can show that you have leadership is important. So even if it is like volunteering, or setting up some sort of social event, or being in some sort of society, you want to highlight kind of these activities that you've done, that that say, well, I was a leader in this, I started this, I continued this, I was able to show this. You'll see research background. Now, a lot of people think that you need a lot of publications for this. I don't think so. I think you need to show a lot of interest, and hopefully somebody that basically can back you up. Don't be afraid if you don't have a Nature publication by the time you apply. We don't expect that. But if you say like, oh, I'm interested in this project, and you can clearly communicate that project and the questions you're asking, what specifically you did, that's really important. Because a lot of people say, like, they'll tack on research in that last few months before application, and go into some random project. But then when you speak to them, or you see what they're doing, like, they can't verbalize it, or they don't know what it is. And that's really important. The scores, that's pretty straightforward. Letters of rec are really important, as I just stated. Conferences, somewhat important. I think that if anything, just if you're able to show that you are interested in surgery in any way, and that you participated, that's always good. And then, as you can see, even things like Dean's List are not very important. Volunteering, health campaigns, it really depends, but specifically for surgery specialties, it may not be, the highlight of your career is not that you went and vaccinated some people. That's really nice, but it's not, that's not gonna take you there. So again, Same thing. But again, I just want to reiterate what we see and how you guys can actually get into surgery. So what is really, truly important? So this is looking at all these different factors. And then I don't know if you guys can see my mouse, but this is considered in selecting the interview, and this is considered in ranking the applicant. So you can see that they vary, but if you look at the 100%, right? So personal statement is incredibly important, right? So if you have a bad or sloppy personal statement, you're not even going to get asked to interview, right? AOA, also important just to be asked to interview, not incredibly important as far as ranking. You know, so you got to look at the things that are ranked highly, 100%. This is incredibly important, and I think that the more I mature, the more I see how important this is the perceived commitment to the specialty. So a lot of these things are actually, you know, the poster presentations, the conferences, the letters of recommendation are really important because we have to make sure that you're going to finish the program. It's a really hard program, and it still has about a 30% attrition rate, meaning 1 out of 3 people will quit and will not finish. And that doesn't reflect well on any program. Nobody wants that. No program ever wants any of the residents to quit, but it happens. And the reason that it happens is that most of the time they don't know what they're getting into. So we really try to tease that out of applicants. Do you know exactly what you're getting into? Do you actually want this? Are you going to be willing to you know, dig yourself out of that hole? Because sometimes you will be pushed in that hole. And then some people are like, if you're not committed enough, you're going to be like, I'm going to be an anesthesiologist, which is fine, which is perfect. But the program director does not like that. The program itself, it just reflects badly on it. So that's really important. Letters of recommendation in that specialty. So, you know, you can be a little bit strategic about this. So if you write a personal statement and you say, even if it's not true per se, like even if you're not 100% committed, but if you say, I want to go to general surgery because I want to be a vascular surgeon, and you write that in your personal statement, and then your letter of rec is from a vascular surgeon, and you're presenting at vascular meetings, you kind of have a narrative there. So that puts you at an ease as far as selecting you and saying, okay, this is somebody who knows what they want. They've shadowed it, they've done it, they've gone to the meetings, and, you know, even if it doesn't happen, at least you're directed somewhere. So these are the kind of things that, you know, I wanted to highlight for you guys. So I would really make a checklist of these sort of things and then just kind of apply based on these things. I thought this was interesting. This is from the Journal of Vascular Surgery of this year. And this is what is the perceived importance of a few of these categories based on before, when step 1 used to be really important, and then when they made it pass fail. So as you can see, you know, in red, so this is post step 1 pass fail. So this is when they're trying to take your test scores out of it. And you'll see that the letter of recs all of a sudden way increase in importance. So that's really critical. Your step 2 apparently goes up. I'm not sure how that is critical, but it is. So you know, it AOA all of a sudden goes up. So you know, people start looking at things a little bit differently depending on how your steps did. And this also shows you, at least in my mind, when somebody doesn't do that great on the steps, not everybody's an amazing test taker, and that's okay. You know, what is going to take precedence over that? It's going to be, you know, a really good letter of rec from somebody that really understands the field, that says, you know, this is a good person. This person really wants to be a surgeon, and you should choose this person to come to your residency. And this is, again, the same thing, post, you know, step 1 scores. What else do they look at? Step 2, letters of rec, et cetera, et cetera. So that's my major spiel about, you know, this, like, basically surgery in general. Hold on one second. Let's see, and I have one question from Monisha. During med school, our hands-on experience is highly compromised. How do we tackle it, knowing that surgery is a very competitive specialty? I'm not sure, Melissa, if you want to answer that, since you're in there with the clerkships.
Yeah. So I think first things first is if you have an interest in surgery, most medical schools that I'm aware of will have an opportunity to do an elective during like in your preclinical years or we call it shadowing. When you have those like breaks in between some of your core classes, like between renal and GI or something. So that's a really good opportunity, as well as if you are a first year, and you're embarking on that summer break, this is a great opportunity to try to shadow physicians or maybe perhaps get involved in research. So I think, and as well as if there's also there's almost every school will have like some surgery interest group. So I think being exposed to the field of surgery is super important just to make sure it seems like it's a good fit for you, because some people come with the notion of it based on, there's all sorts of reasons that's why people are interested in surgery at the beginning. So I think one, having that exposure, um, and two, given that it is competitive, one of the things that I do always advise students who come to me early on is that even if you're considering a career in surgery, you may not end up with it. You may decide to change your mind and go into OB or something. But you should definitely get involved in research projects early. Because that will help with make your application competitive. On average, a student applying for residency match in general surgery has between 5 and 7 research publications or presentations along those lines. So the research category is about 5 to 7 things. And so easier to start that during your first year. Maybe you get on a couple of projects, maybe you have a couple of publications. Maybe again, your third year, you decide you're not going to do surgery and you want to go in OB. Well, that's fine. I mean, those things are only going to help your application in terms of your academic sort of commitment, as opposed to your third year realizing, no, yeah, I actually do want to become a surgeon. And then you're sort of scrambling for what to do. If you are a student who's like that, who's a third year right now, realize they want to go into surgery and you don't have much, super important to talk to your advisors. Sometimes the best thing, depending on test scores and a lot of other things, but sometimes we do advise our students to take a year off and do their research then, and then wait to apply the following year.
It's very competitive to go in, and you have to be very strategic about it, as Dr. Alvarez was saying, and especially when you ask for the letters of recommendation, you should definitely make sure that they write a good letter and give them the CV and give them time, because that can really boost your score. Understand that there's some really more senior surgeons that can especially if they have some sort of tie-in with the program that you want to go to, that have a lot of weight. Things like that are very important. Speaking to the research aspect of it, that's a whole nother can of worms, but if you want to be a surgeon scientist, I think deciding that early is probably better. And residencies, I'm not sure if they really look for that. They do look for that in the sense that you'll stand out, especially if you have something to back it up. You'll say, yeah, I really want to do translational science, as in between my years of residency. And I've done this and this and this, and so I know what I'm getting into. But from what I've seen, that's a lot of the times the decision to become a surgeon scientist happens after you've already selected a program which has a science 2-year elective that you have to do, and then you decide after that. Other people have done MD PhD programs from the get-go, and that's a little bit different. But most surgery programs, a lot of surgery programs will have you do a couple of years of research, and then the person decides whether they want to do it or not, with the idea that you don't really understand the science until you're in the lab for those couple of years, and it's dedicated lab time, and you're actually taken away from surgery. But yeah.
I don't know if there's any other questions. I see Monish's, I'll chat with her directly. Is there any other questions about surgery or?
Hello, doctors. I have one more question. It was really hard for me to type it down, so just unmute myself if I'm not really that bad. So actually, considering on-site research opportunities are like really hard for us to get in because I don't have really a big research background with me. And I'm also a graduate, so it's really hard for me to find more opportunities. Like most of the opportunities are like open for medical students right now. And how important or how efficient are the remote research in like while applying for surgical residency? Like what type of remote research can be weighing in our application?
So from what I understand, so, sorry, because it's a little hard for me to hear, but you are, you have finished medical school but you're not a US graduate. And you
Yes,
are,
doc.
yeah, you're looking for research, right? And yeah, for not for, a lot of the research is for current medical students. Yeah.
Yes.
That is a bit of a different, can of worms. It is very difficult and for someone who is not a US graduate to come into the field of surgery. Not impossible, but very difficult within in the US. To your point, the majority of them will actually apply and get a position as a research assistant and do research in a program. I will say that the majority of students that apply who are not US medical school graduates will have a robust years of research, but that is always balanced with the time that they graduated and the lack of clinical exposure. Because even if you come to the States, you're not going to be able to do a lot of some shadowing and stuff like that. So it opens up a bit of a different discussion because it is quite challenging, and there can be a lot of delay sort of in time. And some people wait 4 or 5 years before they can actually secure a position. So I would say if you were going to try to be strategic about it, just sort of a blanket way, looking at a program that's probably a smaller program or a program that takes the research students, someone like you has a history of taking someone like you and making them a categorical or at least a prelim to be able to obtain a categorical position is probably the best start, because some programs do that routinely and there are other programs that just won't. So you may be able to go to a Hopkins and do this amazing research, but the question is whether or not that's going to be a good opportunity for you to be able to get a position there, or that they're going to vouch for you somewhere else. I don't know, Jonathan, if you have any.
No, I completely agree with Dr. Alvarez. A lot of these things are very strategic, and if you're an FMG, I think I see my friends that have made it specifically in surgery, it's usually a 2 to 5 year commitment before you even get started into a categorical program. So that means you do the prelim first year, the prelim second year, and either you did 2 or 3 years of research before that or after that. That's just a part of the way it is, and being strategic about the programs where you choose to do this is also incredibly important. Like Dr. Alvarez says, there's programs that'll notoriously never take any FMGs, and then people will say, oh yeah, this is great, I'm doing my prelim at Harvard, but then you're basically their scut monkey for a year, and then they don't give you anything. And so you have to be very strategic about that.
I see there's a question about, I see there's a question about some research in another surgical specialty. I would say that if you're applying, I think there's, Dr. Villena mentioned, trying to be strategic to create a story. However, sometimes we'll see a student come through who maybe did a bunch of cardiothoracic and then just really decided they want to go into gen surg. I think you just need to have your story sincere and genuine and down. So sometimes I'll say, oh, I see you did a bunch of cardiothoracic. I mean, I understand you're a medical student. You may have just found a mentor in that field and they really influenced you and you did it. you had the opportunity to do a lot of work, amazing, but like, why are you applying to gen surge? Or, you know, why aren't you applying to an integrated program? Or do you really want to do this? Do you really want to be a pediatrician? You know, like that sort of stuff. So I think it's super important to say, look, I had exposure to this one specialty. But, you know, I really want to do, you know, do surgery. I think it's more when like someone's done like a ton of like OB research and then they want to be a general surgeon. We're always like scratching our head. I think if you've done cardiothoracic surgery and now you're applying to gen surge, that's perfectly fine for me. Like, I'm like, okay, great, amazing. You're a hardworking person, and that's good enough. I'm not going to really question that.
I definitely agree. There's a question about doing some research in other surgical subspecialties, and I think that's always a plus. Like, yeah, that was just said. Would a graduate degree significantly add to my residency application? I'm going to put it from my point of view. I think it depends on the quality, you know, comparing like a master's in public health versus a year of research. It really depends on the quality of research that you get out of it. You know, with a master's in public health, you'll always come out with a master's in public health, which adds those few letters, which is always nice, right? Especially if you're actually into it. If, you know, that year or two of research, you don't come out with any publications, or it's in something that you're not really interested in or passionate about and can't, you know, really speak to it, then the master's probably helps. But I wouldn't, you know, I probably would just try to do something that you think you actually want to do and are passionate about, as opposed to saying, you know, what is better than the other one as far as, you know, what we're looking for, because every program is a little bit different, and within the program, everybody that interviews you is a little bit different. So I think there's no right answer to that, as long as, you know, if you do a master's in public health, is because you say, I was really passionate about public health, I want to do this is how I want to tailor my career, and et cetera, et cetera, et cetera. If you do it because you're just like, oh, I'm trying to plump up my CV, that's a different story. And it's interesting how apparent it becomes. We all think we're too smart, but it comes across, right, when somebody's really passionate about something, as opposed to just putting it on there.
Yeah, no, couldn't agree more. I think if that's part of your story, and I think, again, don't waste that time if you're not going to actually use it. I mean, I'll be honest, I wish I had my master's in public health. I had done that when I was out, because my research is not, you know, basic science research, like Dr. Villena. So, you know, so yeah, and that would have been certainly part of my story about like things that I'm interested in and the research that I'm doing, compared to, yeah, if it's just like something to plump your CV, I would say, get some research projects. But again, you have to be mindful that even if you just get a master's, people are going to go, oh, that's nice, but like, it still is not going to check off that research piece. So you'll have done something as part of your graduate work, you'll have a project or two. But certainly a person who took a year off and comes out with 5 publications, that's going to check that. And that's going to be much more powerful than just saying I got a master's. So, yeah. It doesn't really excuse you from the research piece. I think that's part of what I'm trying to say is, if you can get your master's, again, I would have done it, but alongside all of the research stuff that you're still going to be doing as part of to make yourself competitive as an applicant. Hi.
Hey, thank you both so much for doing this. So I'm Nathan. I'm at University of Illinois, Chicago, and I'm at the MD PhD program here. Actually, I just started my 3rd year. So my PhD was in biomedical engineering using like multi-omic approaches in GI disease. So I'm deciding between colorectal surgery and plastic surgery. And I was just like wondering if you could offer any advice on becoming a surgeon scientist and how to consider residency programs that have built-in research years. So I mean, I have some mentors here at my institution, but in general and like at conferences and stuff, I find that there's not very many surgeon scientists. So like the path forward there is a little murkier than if I wanted to go, say, into an internal medicine specialty. So just if you have any advice on that.
Sure. I mean, I think that as far as surgeon scientists go, there are very few. I think it's like less than 4%. And so you have to be a little bit cross-discipline, if that makes any sense. If you're looking at multi-omics or whatever than GI. I think that colorectal is the right choice, but you can always do plastics. I think plastics you can basically, it's a fantastic field if you actually want to, I think, really do it. The way to reach out, I would probably get in with the NCI, NIH people fairly early on, especially in the NHMA as well. But doing these sort of like these small things that are tailored nationally to surgeon scientists and will put you in touch with a lot of different people like me per se, because there's so few of us that you definitely have to cross disciplines. But the idea is still the same. The concept of grant writing, of academic medicine, of translational research, of running a lab and being a surgeon at the same time, it's the same principles. So it doesn't really matter what specialty it is.
Could you speak a little bit more to that in terms of how you balance your clinical duties? Because I know the split is a little different when you're a surgeon. You can't do research 80% of the time and be a surgeon 20% of the time.
That doesn't exist. There is no percentages. That doesn't exist. The concept of percentages are gone. So, the way to think about it is really about going, after you're done, right? So let's assume you're a brilliant scientist and you finish your PhD, you get your good publications, and then you're a good surgeon, so you get to get a good job. So when you look for a job, you have to look for the job that has the correct infrastructure for you, meaning that someone or an institution that will support you 100%. They're not going to tell you this is your research day, this is your surgery day. That just doesn't happen. You have to carve your way out of it. But what they can do is say, we will give you lab support, we will give you a tech, we will give you a postdoc. And then like I have here at Cornell, I have fellows, I have an army of nurse practitioners, I have an army of coordinators that help me answer my emails, help me coordinate my meetings, see all the patients, write all the notes. The fellows open the patient, I go, then they close the patient up. And same with the research. I don't do any of the actual manual stuff anymore. It's like my postdoc, I have lab meetings, and my job switches from being like the key parts of the surgery and the writing grants and getting funding and going to lab meetings and running the lab meetings and kind of swaying the lab one way or another, instead of doing all the other stuff that just piles on. So you really have to kind of, and you drive, you are your own CEO. You're creating a corporation that is built on yourself. There's a hospital and there's a system, and everybody's going to want you to do certain things. Everybody's going to want you to pull you certain ways, certain directions. They're going to say, oh, you should be the quality assurance officer for this, and you should be in this committee, and you should do that. And you can say yes, yes, yes in the first few years, but you really have to make your own way. And only you understand how you work. Meaning, like, if you have to do a lab at night and you can only operate one day a week, and you want, clinic this day and that day, you have to make that happen. You have to understand how you work best, because that's the only way to do it. So right now I have one administrative day, which is Tuesday, which is, today, and I do all my lab and all my research in there, and then I try, I have my block times Wednesday and Thursday in which I operate. I have my clinic on Friday, which is a half day, and a clinic on Monday. And then, when it comes crunch time, like Dr. Alvarez was saying, you have to write grants. Those are the late nights, those are the weekends. But you don't want to go in there and want to be, go through this process of wanting your own lab and then go work at a place that makes you cover every weekend, makes you stay up all night, covering all these emergencies. You have to choose incredibly wisely if you actually want to get something off the ground. And they should choose you incredibly wisely, and give you that protected time, value you for what you're bringing. So it's a hard process, but when you find the right place, all you can do is expand your lab, expand your practice, and you just get bigger and bigger.
If I can just follow up on that once more, and then I'll stop asking so many questions. Do you think that I should prioritize that kind of protection for research for my residency training, or since I have a PhD already, do you think that I should fully focus on the clinical aspects during residency and then look for those things when I'm negotiating a job?
You have your MD PhD, so I think you check that check mark of saying this guy is dedicated to research. It really depends on if you decided on what you want to go into. So, if you're saying plastics and you go into a plastics residency, then maybe if they require a year of research, try to find a niche in plastics that you can apply your science to. But you don't have to do that. You can decide that afterwards. But it does kind of help you, understand the landscape of where you're going to get a job, of who's in that realm, of what actually interests you. That's more job specific. But it's not, completely required. That being said, when I took 3 years off and I went back, I didn't miss a beat, right? I forgot a couple of the instrument names, but they come back to you in a couple of weeks and then you're fine. So you don't miss much by getting, leaving, especially after your first and second year, where it's very different from your senior years in residency. So, if you can tailor it and you find a good spot for research, I think you should go for that.
Thanks.
Any other questions?
Just an overall comment. I hope everybody that's on here has found a really good mentor that can really guide them through the process. I think that's really, really important, as it cannot be overstated. And by mentor, I don't mean somebody that can just, writes you a letter or says nice things to you, like somebody that can really sit you down and say, this is the right career choice for you, or you should go to this place, you should not go to this place. That can be very real, because sometimes you need that. You don't want somebody that's super busy and it's just like, yes, apply to everything. We'll just glance at your personal statement, we'll just glance at your letters of rec. You need someone that really backs you up and makes those phone calls and really thinks about you and your career.
Definitely agreed upon, with the mentoring sort of advising piece. So I'm just trying to see what those are. Someone said, what advice can you give for finding the right mentor? I think like something like what we've been kind of mentioning, the theme is about being a bit strategic, but I do think that it is important to find someone that you identify with, connect with, relate to. There's a lot of data that shows that people, and I've experienced this myself, people sort of seek out mentors that they don't necessarily have a connection with, and then there's no real relationship there. So you want to pick someone that you are going to be coming back and forth to and following up with, and that they're also going to be reaching out saying, hey, what's going on? We haven't seen each other in a while. So I think like that's really it. Otherwise, that's really for a mentor. If you just want like a advisory role, then certainly we could have like a one-off with me, and sometimes I'll have students do that. Just come and just have a one-off. They know I'm the clerkship director and they just want to have a little bit of information, but I never really hear or see from them again. So it just depends on what you're looking for, but I do think you still, regardless of what you're using each person for, you should have someone who's like, ingrained, knows you, that you meet with regularly, that is really there to support you and help guide you or get you to the right person. Say, I don't know the answer to that, but why don't you meet with Dr. Alvarez, because she's the clerkship director and she can answer those questions, right? So then I can give you that information and you still take it back to your mentor to continue working on your plan and what's forward. So so I think finding someone that you really can connect with, and that, was willing to put that time in, and mentor you and meet with you regularly. I think that's really important.
Yeah, no, I completely agree, and really understanding the why, like why you want that mentor, why you are choosing a specific mentor, meaning that, the way I chose my mentors is, I had one surgeon scientist that I saw was very early in his career, and I wanted to see how he did it. And so I pestered him and observed him and really studied his career, and that guided my own career. So I understood exactly why I chose that mentor and why I kept pestering him. And he could see that I was observing and emulating him and asking him like the real questions, like, when do you do this? Why did you do this? How can I do this? Because I understood why I chose him as a mentor, not because, he has a pretty face, or he's very nice to me, or he's just there. It's you really have to understand the why of what you're doing everything, and that goes along with the strategy and such. But even understanding the why isn't like, okay, I choose this person to be my mentor because even if I don't really like that person that much, that person has a lot of sway into who gets into this residency program. So I'm going to make sure that that person knows who I am, and treat them like a mentor. And I think that's totally fine. But you just have to understand the why. What makes an FMG stand out while applying? So I don't know about Dr. Alvarez, but I get probably 2 to 3 emails a week from FMGs that want to do research. Some of them are incredibly long. Some of them are incredibly short and misspelled. Almost all of them come with CVs. And I think what, at least from that aspect, makes it stand out for me is persistence, first and foremost. Meaning, like, it'll continue to keep happening. They'll continue to contact me. If I ignore them once, twice, or 3 times, all of a sudden I'll start paying attention. How succinct they are about what they want. And I think most surgeons and everybody is really pressed for time. So when I see an email that says, I am from this and this is what I'm doing, this is what I have, this is the time, I have 1 year, 2 years that I want to dedicate to this for this reason. It can be very short, but they know exactly what they want. Those people will stand out to me. And any sort of personal connection obviously stands out. But those are the major things. What about you, Dr. Alvarez?
Interesting. I actually get a couple, probably certainly not as many as you, but emails. I just had one like the other day. Even though I don't actually run my own lab. So I will say that one, know who you're emailing. Sometimes I also get these emails that are like, I used to respond actually, like just out of courtesy to say, thank you, I don't have research for you, but now I just delete them because people write like a blanket email and then they just send it to like, I don't know how many surgeons, like that doesn't even have my name. They're asking about stuff like a bench research science. I don't do bench research. So your experience on running all sorts of assays and stuff brings me back like a little bit of nightmares from my days day and age. So asking me about that is not helpful. So yes, I think knowing who you're reaching out to, being specific, as Dr. Villena said, and having it be well written and direct to them. I think those little things go a long way because we get bombarded. Sometimes I come out of the OR and there's so many unread emails and my, just from like all the different roles and hats that I play, that I wear. And it's a lot to have to go through and try to respond to those and stuff. So sometimes it can be quite frustrating when you get this like blanket email that's like really long and not well written and talking about things that I don't do. So I think if you were trying to get in to, someone like Dr. Villena's, lab, then you should be very clear about his research, what your interest is, what you want to do. And the email should be 100% to him, as well as be, grammatically correct and all those sorts of like nuances that just make it come across as just a better impression based on what we see.
There's I almost always, if somebody makes a good impression of me, for me, or of themselves for me, I will try to have a short Zoom meeting with them, even if I don't have a position available, even if I can't offer much, just to understand who they are and what they're looking for, and if there's any way I can help. And it happens a lot of times, maybe not immediately, but some opportunity will pop up and I'll remember that person. And I'll try to link them up with either other researchers or a project that just came up a few months later. And that's happened to me a couple of times. And it really is because that person did their homework, right? They understood me and they reached out to me for a very specific reason, and or they were persistent and kept reaching out. And even if it wasn't, because I couldn't offer anything, they still kind of reached out and said, hey, I'm still here. This is an update of what I'm doing. Those, if you're like that, sometimes we try to help you, but if you don't put any effort into it, I think, it's just one more email that can be spammed, right?
Okay, any other questions? Last call. All right, so I don't see anything popping up, but thank you all for attending, and hope that was informative and useful. So have a good evening.
Take care, guys.
See
Take care, Melissa.
you, John.